The role of doctors and other healthcare professionals in helping the uninsured gain access to medicines is critical, but doctors often do not know what is out there for their patients and helping them pay for prescription drugs. Welcome to Inside Healthcare on ReachMD XM Channel 157, the channel for medical professionals. I'm Bruce Japsen, the healthcare reporter for the Chicago Tribune, and with me today is Roba Whiteley, the executive director of TogetherRx Access. TogetherRx was created by some of the world's largest drug makers, including Johnson & Johnson, AstraZeneca, and GlaxoSmithKline, as a way to provide discounts on brand-name medicines for those having difficulty paying for prescriptions. Ms. Whiteley became executive director of TogetherRx in July 2004, when the program was largely known as a prescription savings program for lower-income Medicare beneficiaries. Roba Whiteley, welcome to Inside Healthcare on ReachMD.
Thanks, Bruce. It's a pleasure to be with you.
So tell us about TogetherRx Access, and what do doctors need to know about getting their patients some cheaper medicines? I mean, we know doctors are very busy people. They get inundated, both good and bad, from a lot of your company's sales reps all the time, and it's more of a challenge to reach physicians. So if you could, tell us a little bit about your program and what doctors need to know.
What doctors need to know is that many people that they see every day don't have the benefit of prescription drug coverage, which means when those patients leave their office with a prescription, that there's a 1 in 3 chance that that patient will not fill that prescription. It means that their condition perhaps won't improve, or their chronic conditions may not be managed in the ideal way, if at all, and that cost affordability is a major barrier to people maintaining and getting help, maintaining health and getting healthy when they have health problems. So TogetherRx Access, a prescription savings program, is something that helps particularly the moderate income uninsured people be better able to access their medicines and take care of their health. The card is free, it's free to get, it's free to use, and it's easy to apply. The patient can click on our website, TogetherRxAccess.com, or they can call a toll-free number, 800-966-0407. But even more importantly, any doctor who's listening to your program today, Bruce, can call that number, 800-966-0407, and order brochures to put in their office to give to their patients who need a break on the cost of their medicines if they don't have the benefit of coverage. You know, every year in America, the Institute of Medicine estimates that over 18,000 people die simply because they don't have the benefit of coverage. So it's an important issue, but it is something that we think in some way can be helped by programs like TogetherRx Access.
Now, TogetherRx is a discount card program, and a lot of people who even do have basic bare-bones benefit packages often think that they might not be eligible because of various criteria with the insurance companies. But these discount cards can be used with other coverage, can they not?
If you have coverage that does not include prescription drug coverage, absolutely. And if you have a public program that's helping you with your health care, and that does not include a prescription drug benefit, you can also be eligible in those instances. So if you're someone who doesn't have prescription drug coverage, either private or public, you're not eligible for Medicare, and you're a legal U.S. resident, we urge you to click on TogetherRx Access to learn more and to get in the program. Doesn't cost a penny. As I say, it's free to get, free to use. It's just the real deal that gives consumers who are uninsured a break on their medicines.
Give us an idea of the kinds of drugs that are covered. I mean, physicians, medical professionals tend to be your primary care and your internists, those types of doctors, pediatricians who are dispensing pills, tablets, and capsules. Are these a lot of the things that we're talking about here? Because even if you were to get a 25 or 40% discount on an expensive cancer medication, that's probably not going to do you a heck of a lot of good. But those are not generally the drugs we're talking about, are we?
No, we're talking about drugs, medicines, or prescription products like glucose testing strips, which are also available by using the TogetherRx Access card. Medicines and products that you would get at your neighborhood pharmacy. This is what we call a retail prescription savings program. So anything that you would take to the counter of your neighborhood pharmacy is what benefits you with the TogetherRx Access card. We have over 300 brand name products that are currently available in the program, and we're working very hard to encourage other pharmaceutical companies to join TogetherRx Access so that we have many more products so that patients have the advantage of getting the right medicine at the right time for whatever condition or disease they happen to suffer. The products that are available in the program are for most of the conditions people suffer today: high blood pressure, hypercholesterolemia, or other lipid disorders, diabetes, asthma, allergies, two conditions that are frequently a reason for using the card with children, cancer, and I should say also mental health. You know, it's very interesting as we look at the products for which people use the card. The first therapeutic area is cardiovascular. That's probably no surprise to any of your listeners. But often people are surprised to learn that the second therapeutic area is mental health. And I'm particularly eager to do outreach through the patient advocacy groups like NAMI and mental health associations to let people know about the card because, you know, health and wealth are very closely connected. And if someone is suffering from depression or bipolar disease or other mental health problems, if they don't have their medicine, they aren't going to be able to find jobs or keep jobs. In fact, we know that each year estimates are that somewhere between $65 and $130 billion are lost to our nation's economy simply because people can't take care of their health they don't have access to medicine and other health care. So there are many reasons that people need to get a break on their medicines, and we also encourage people to contact the Partnership for Prescription Assistance, which is a clearinghouse of over 475 public and private programs, which can help people sometimes save even more on their medicines and sometimes help them get their medicines for free.
Well, if you're just joining us, you're listening to Inside Healthcare on ReachMD XM 157, the channel for medical professionals. I'm Bruce Japsen, the healthcare reporter for the Chicago Tribune, and with me today is Roba Whiteley. She's the executive director of TogetherRx Access, which is a group, has come together from a group of drug companies that are offering discount cards to the uninsured. Now, this program might be familiar to our listeners out there in the medical profession as sort of a bridge to full Medicare coverage. When Medicare's full benefit went in 2006, TogetherRx provided discount cards that met with some success as a bridge to Medicare drug coverage. And now they are being involved with the issue du jour in today's presidential debate, which is covering the uninsured. And Roba, if I could ask you maybe a little bit of a difficult question, as I know you're in the Washington area and you are well familiar with your friends at Harvard who are for the single-payer program and advocates of single-payer that have said they don't really think that the poor benefit from these drug discount programs, and it's largely wealthy people. Could you talk about that? I mean, you may be familiar with that study.
If I may, I think that wasn't about drug discount plans. That was more about samples that doctors provide to patients when they come into the doctor's office for a visit, which is a very different issue than the issue we're talking about today, which is ways to save money on your medicine with prescription savings.
But I guess to that end, are these drug discount cards, are they used? And if you could give us an idea of who is using them.
This card, TogetherRx Access, is for people who are at or below 300% of the federal poverty level. And that translates into, for an individual, someone who earns $30,000 or less, or, for example, a family of four that would earn $60,000 or less. This is really what we call the emerging uninsured. This is not a poverty program, although anyone under 300% with those income criteria are eligible for TogetherRx Access. But really the big emergence is the moderate income uninsured population. And those folks really, really, really need to have a break for themselves and for their families. And when I define it as moderate, we hope also that for people who would be at lower levels of income, that our card becomes if you will, a gateway to other programs that can save them additional money or sometimes help them get their medicines free. And free, as an example, would be patient assistance programs that are made available through individual pharmaceutical companies where they actually provide their medicine at no cost to low-income people. So the idea here, and as you've talked, I've been involved in advocacy issues and healthcare issues for many, many years. The issue is, can you get people into a position where they begin to get engaged in taking care of their health? And then can you help them find the very best ways that they can manage to take care of their health in the very best way for the very best price? And that's why, as I'm talking to you, we want everyone who thinks they could be eligible to visit TogetherRxAccess.com or to call 800-966-0407. And when they call that number or visit the website, there will be a way that they can also contact the Partnership for Prescription Assistance, which once again is a clearinghouse that can help people connect to other programs that may save them additional money or maybe help them get their medicines for free.
And how many of these people are you signing up since you guys have been pushing the renewed effort here to get discounts to the uninsured? About how many are we reaching, or the companies reaching that you know of to date?
You know, we're very proud to say to this very hard-to-reach population, we now have nearly 1.4 million people in the program having the benefit of access to medicines. And as I say that, we have about 10,000 people enrolling across the nation every week, which is a staggering number. We're very proud of that. But you know, Bruce, it's not enough. So always so grateful for the opportunity to do programs as we're doing today to get the word out to healthcare professionals who are the point people who know when someone's uninsured, who know when someone needs medicine, to give them a little tool that they can provide to their patients, where they can simply call that toll-free number or click on the website and instantly get in a program that will give them a break.
Well, with that, I would like to thank Roba Whiteley. She's been our guest today. She's the Executive Director of TogetherRx Access, which is a drug discount card program that was used with some success as a bridge to full Medicare drug coverage for seniors in this country. But they've moved on to an even larger issue, which is the 47 million uninsured. I'm Bruce Japsen, the healthcare reporter of the Chicago Tribune, and you've been listening to Inside Healthcare on ReachMD XM 157, the channel for medical professionals. We welcome your questions and comments through our website at reachmd.com, which now features our entire medical show library in on-demand podcasts. I would like to thank you today for listening.